Welcome everyone, and thank you for joining us for today's webinar, Electronic Prescribing for Controlled Substances, How to Meet DEA Requirements and Drive Provider Adoption. I'm Chris Higgins, Marketing Programs Manager with Imprivata, and I'll be your host for today's session. I'm excited to be joined today by Dan Borgesano, Director of Product Marketing here at Imprivata. Welcome, Dan. I'm going to hand it over to Dan in just a minute, but before I do, I have a few quick housekeeping items for our audience. First, everyone who registered for today's session will receive a recording of the webinar. Second, if you have any trouble with the audio or video today, try logging out and logging back in, which in most cases should resolve the issue. And finally, please feel free to ask questions at any time via the Q&A panel on the right-hand side of your screen. We'll leave time at the end to get to everyone's questions. All right, that's enough for me. I'll turn it over to Dan to get us started. Dan?
Everyone, thank you for joining today's discussion, where, as Chris mentioned, we'll be talking about electronic prescribing for controlled substances, or EPCS, and how to meet DEA requirements and drive provider adoption. So some of the things that we'll cover today is why EPCS matters and some of the drivers for adoption. We'll then go through the DEA requirements for EPCS. We'll then provide an overview of Imprivata Confirm ID and how the solution can help you meet those requirements as well as drive provider adoption for EPCS, and then we'll open it up to questions. So let's start with why EPCS matters and why we're talking about this subject today. Well, first and foremost, and the reason why the DEA initially legalized electronic prescribing for controlled substances is to combat the national public health epidemic, which is opioid and prescription drug abuse. So it seems like every day we read at a national and local level about this tragedy that's facing America. And one of the ways that we can address opioid abuse is by giving providers more tools to make better prescribing decisions and head off things like drug diversion, doctor shopping, and forgery off as early on in the process as possible. So again, this is really the primary reason why the DEA legalized EPCS in the first place. But there are a number of other reasons why EPCS makes sense. And another is that many states are starting to adopt EPCS as a way to fight the opioid epidemic. In fact, as of today, there are now 12 states that have passed EPCS mandates. California actually signed its law last week, becoming the 12th. So you can see here the 12 states that have passed EPCS mandates. New York was the first a couple years ago with their I-STOP law. Since then, Maine and Connecticut have gone into effect, and then the 9 others have passed laws that will all go into effect over the next year or two. There are also about 10 or so additional states that have introduced EPCS mandates that are at varying degrees of the regulatory process. And from a federal perspective, there was a bill introduced last year that would require electronic prescribing of controlled substances for all medications prescribed to patients who are participating in the Medicare Part D prescription drug program. There's about 40 million or so Americans in that program, so really this would impact organizations nationwide. Now that bill has been progressing through the regulatory process. It actually passed the House and was recently signed by the Senate. So now the two bills are being reconciled, and then it will go to the President's desk for signing. If passed, that will require ERX for, again, all Medicare Part D prescription drug prescriptions by 2020 is the deadline for that. And then there are also industry influences that are affecting the move to EPCS. For example, Walmart recently announced that it will require electronic prescriptions for all controlled substances starting in January of 2020. So as you can see, there's a significant regulatory and industry movement towards electronic prescribing, which is necessitating, being prepared from your and your organization's perspective. But there are also impacts to your providers and your patients and your organizations and benefits that you'll see from EPCS. And a lot of these stem from the challenges associated with the use of paper prescriptions. So first, if your providers are using electronic prescribing for non-controlled substances, they're most likely faced with a dual workflow. They can send the non-controlled substances electronically directly to the pharmacy. It's fast and it's easy, but they're required to print out the prescriptions for controlled substances on paper, give it to the patient, who then must bring it to the pharmacy and have that prescription filled. So that's two different workflows for your providers, and in many cases when they're prescribing controlled substances, they're actually prescribing a non-controlled substance as well. So they're faced with this dual workflow many times when they're prescribing medication. And so not only is that inefficient for your providers, but it's also inefficient and dissatisfactory for your patients, who now have two different ways of getting their medication, and it fuels that opioid epidemic, as we talked about, because the provider's DEA number and other information is on that piece of paper, which can be forged and diverted or otherwise subject to fraud that, again, is fueling the opioid epidemic. So if you move to electronic prescribing, you make everything much safer, much more secure, and you don't put that DEA number in the patient's hands. Now, in response to the opioid epidemic, we're also seeing a number of new laws being passed at the state level that really put restrictions on how and how often controlled substances, and particularly opioids, can be prescribed. So, for example, there was a law passed a couple of years ago that moved Vicodin and similar drugs from Schedule III to a Schedule II controlled substance, which meant fewer refills and fewer consecutive prescriptions could be prescribed. There are also laws that limit the initial prescription of opioids to 7, in some cases even 3 days. So all of these are really exacerbating the challenges associated with paper and the dual workflow, because they'll ultimately amount to more prescribing transactions for your providers. And again, that will really expose the challenges of paper, both from an efficiency and provider satisfaction perspective, as well as patient satisfaction and safety. So the good news is the DEA allows electronic prescribing for controlled substances, and you can really address a lot of these issues. However, there are a number of unique, specific, and often complex requirements that the DEA has before you can move to EPCS. So the DEA's goal is to establish what they refer to as non-repudiation with absolute certainty, or what we often refer to as a secure, auditable chain of trust, so that in the event of diversion or fraud, they can trace back with absolute certainty who the patient was that received the prescription, what pharmacy it was sent to, what information was the prescription had on it, and who was the provider that prescribed that medication. And is that person authorized to prescribe controlled substances? So in order to do that, the DEA wants to establish a secure chain of trust from complete end-to-end. And at a high level, that starts with the ability to do EPCS first must be legalized at a state level. And to date, every state has passed an EPCS law that allows prescribing of controlled substances for all Schedules 2 through 5. So EPCS is now legal in every state. The DEA also has very specific requirements for the applications that will be used, both the EMR or the e-prescribing application, as well as the pharmacy technology that's being used to process the prescription. So both of those need to be certified, and to date, nearly every major EMR or e-prescribing application, as well as most pharmacies, are certified for EPCS. And then, as many of you may be familiar with, there is a two-factor authentication requirement, where at the time of prescribing, the provider must enter 2 factors of authentication to confirm their identity and send that prescription through. But these are just some of the high-level requirements for EPCS. And really, again, because the DEA's goal is to establish that secure, auditable chain of trust, there are many more very specific and unique requirements that your organizations and your providers must meet before you can enable EPCS. So, for example, it starts with a nomination process. You must first establish that list of providers who you're going to give permissions for EPCS to. And usually that's aggregated in the credentialing office or some centralized office compiled from lists from your EHR or other applications. And that list must be signed off by 2 people within that entity in your organization. From there are 2 parallel paths that you must take, and they must be separate. So there's an identity proofing step. This is where each provider must prove they are who they say they are, they're authorized to prescribe controlled substances, and that's going to be done in one of 2 different ways, and we'll go through the differences in just a moment. Once they validate their identity, they also want to bind their identity to whatever authentication credentials they'll use for EPCS. Whatever those two-factor modalities they'll use must be bound to that provider's identity through a credential enrollment process. Now, separate and in parallel to that, there's a logical access control step. And this is where you'll actually configure your EHR or your e-prescribing application to give those approved providers permissions to do EPCS. Now, in this step, the DEA says there must be at least two people involved. First is the individual who will actually configure and give permissions in the application to that list of approved providers. But then a second person must actually go through an approval workflow to approve that that configuration was done correctly and permissions were given to the correct providers. And again, that logical access control step must be separate from the identity proofing and credential enrollment. As I mentioned, there's two-factor authentication at the time of prescribing, and the DEA has some specific rules around that, which we'll cover in just a moment. And then all of these steps, as well as a number of other pieces, you must have audit records kept on those and be able to generate reports so that, again, the DEA can see that you have a complete audit trail from end to end. So as you can see, there are really a number of very specific steps and processes you need to have in place that are unique to EPCS before you can enable this workflow for your providers. And I'll just spend a little bit of time going through each and what the DEA requires of you. So first we'll start with identity proofing. And so as mentioned, the DEA offers allows two types of identity proofing, individual and institutional. So we'll start with individual. Now this is where each provider will use a DEA-approved third-party credential service provider, CSP, or a certification authority, CA, to complete the required identity proofing. And this can be done remotely. The provider will go to typically to the website of the CSP or the CA, and they'll answer a series of personal information. A lot of it will come from their credit report. And this is what the CA or CSP will then use on the back end to validate their identity. Once they successfully complete that process, they can be issued the two-factor authentication credential, and that will be bound to their identity, and they'll use that for signing EPCS orders. Now, individual identity proofing is required if the organization itself is not a DEA registrant. If you're not an institutional practitioner, if you don't have an organizational DEA number, then you must use the individual identity proofing option for EPCS. Now, the other method is what we refer to as the institutional identity proofing, and this is reserved for organizations that have a DEA number. The organization itself is an institutional practitioner. Now, in this case, the DEA is granting you the authority to conduct this identity proofing in-house. So it must be done in person. So unlike individual, it cannot be done remotely. It has to be done in person. Now, here, the provider must show, at a minimum, a government-issued photo ID to prove they are who they say they are. So unlike the individual, they're not required to answer the series of questions and things. And the reason for that is because as an institutional registrant, as an organization with a DEA number, the DEA concedes that you already have processes in place where you've done thorough background checks on these individuals, and you monitor their DEA number status, their license to practice medicine, etc. So here the DEA says that before you issue the two-factor authentication credential, you check a government-issued photo ID, and you create a record of that. The DEA says it must be kept for 2 years, that record, although some states require you to keep that for a longer period of time. So within the institutional identity proofing model, a couple of questions often come up. The first is that if a provider is already credentialed at your organization and they're prescribing controlled substances today using paper, do they need to go through this identity proofing again? And the answer is yes, they do. And you can see the language from the DEA interim final rule, or IFR, right there that covers that requirement. But essentially, before you can move to electronic prescribing, to EPCS, before you can issue that credential that will be used for EPCS, the DEA requires you to check a photo issue ID of these providers. So again, all providers moving to EPCS, whether they're existing and credentialed today or a new provider coming on, must go through this identity proofing process. Now, the other common question that we get related to institutional identity proofing is, will providers use the organization's DEA number when prescribing if we use this model? And the answer is no. They'll continue to use their individual DEA number, and that's what will appear on their prescription in electronic format, just as it does on paper today. Now, if you have residents or other mid-levels who may not have their own DEA number and they use the organization's DEA number followed by that unique suffix, they will continue to use that in an electronic format just as they do again on paper today. Having the organizational DEA number simply entitles you to conduct the in-house identity proofing. But again, for the prescription itself, the provider's individual DEA number will actually be on the prescription just as it is today. So that covers the identity proofing step. And so now we'll talk a little bit about logical access controls and what's required there. So as I mentioned, the DEA, in addition to the identity proofing step, requires you to undergo a logical access control process whereby you'll actually configure your EHR or your e-prescribing application to give that list of approved providers permissions to do EPCS, to go through the EPCS workflow. So those who are setting the logical access control must be a separate group from those that are conducting the identity proofing and enrolling credentials. And again, within this logical access control step, there must be 2 individuals or groups assigned to manage the process. The first group is those who will actually take that nomination list, that approved list of providers, and give them the proper EPCS permissions within the EHR. But before they can start using it, a second individual must actually go through an approval workflow, and you've got to keep a record of both the setting of the logical access control and the approval of those permissions. So the DEA sees the separation of duties and this checks and balances on each step of the process, again, to create that secure, auditable chain of trust. Now, the EPCS approver, that second individual approving these permissions, their status as a DEA registrant is necessary if you're using the individual model, but not in the institutional model. So if you're using individual identity proofing, where again you're having your providers go to a third party, a CSP or a CA, then the person approving these logical access control setting must themselves be a DEA registrant. However, if you're using the institutional model, that EPCS approver does not need to be an individual DEA registrant. In some cases, as a matter of best practice, we do see that it's often a small group of individuals who are that EPCS approver in the institutional model. Many of them do have a DEA number themselves, but again, not a requirement. So now we'll talk a little bit about the 2-factor authentication requirement for EPCS. So again, the DEA requires 2-factor authentication at the time of prescribing. The provider must enter 2 of the following 3, something they are, such as a biometric, something they have, which is most often a token, or something they know, which is a password. 2 of those 3 at the time of prescribing. The question we often get is if the provider has already logged in to the EMR using a password or some other form of authentication, have they completed the first factor? And the answer is no, they haven't. The DEA wants 2 factors of authentication at the time of prescribing in order to send that order through to the pharmacy. Now, sometimes you may be speaking with a vendor, a token vendor, for example, who is talking about EPCS and shows you just the second factor of authentication and how that can be used for EPCS. And it may give the impression that all you need is that token, all you need is that single factor. But what they're not showing is the piece they don't manage, which is the password natively typed into your EHR. And so I bring that up because it may give the impression that a single factor is all that's required for EPCS, because that's all they're showing you. And I just want to make it clear that it is 2-factor authentication at the time of prescribing. So given all those requirements, that the DEA has for EPCS and all the complexity that goes into compliance, the question becomes, how can you meet all of those requirements and roll out a fully compliant solution that establishes that secure, auditable chain of trust while also driving adoption by giving your physicians a workflow that they will love? So putting two-factor authentication in front of providers in the EPCS workflow introduces a potential barrier to slow them down. And while you may implement a solution that's good enough to meet DEA requirements and check the compliance box, it could lead to missteps along the way, including giving your providers a very clunky, inefficient workflow that takes a bad workflow, paper, and makes it even worse. So the question is, how can you balance meeting all of those DEA requirements and, again, still make that EPCS workflow fast and seamless for your providers? And that's exactly what Imprivata Confirm ID is all about. So first, it's designed to be the most comprehensive solution for meeting all of the DEA requirements for EPCS. It goes well beyond just the two-factor authentication requirement. It's going to give you all the tools and reporting mechanisms that you need to meet the identity proofing, the credential enrollment, the logical access control, two-factor authentication, and then all of the reporting components that go along with it. From a single solution, you'll have end-to-end compliance to help you meet all of the DEA requirements for EPCS. We'll walk through in a little bit of more detail about how the product helps you do that. So first, let's talk about identity proofing. And Imprivata Confirm ID can support both institutional as well as individual. So we'll start with the the institutional model. So within Imprivata Confirm ID, we have a role that we call enrollment supervisor. And this is a role you can assign within the product. And this is the person or group of people who will actually be charged with checking the provider's government-issued photo ID and then enrolling whatever credentials they'll use for EPCS into the system. And it will create a record of that. So you could see here what the wizard-driven tool looks like. The witness or the enrollment supervisor will check the form of identification and put in any notes that they may wish or you may require on that individual. And then that witness will actually authenticate themselves. And that will create an auditable record of that transaction that the provider did show proper ID to validate their identity. Immediately thereafter, that enrollment supervisor can help the provider enroll whatever authentication methods they'll use for EPCS. In this example, you could see it's fingerprint, but it could be the token that's running on their phone. And that will bind the identity of that provider who just went through identity proofing to the credentials that they'll use for EPCS, and it will create a record of that transaction as well. So all of this takes about 2 minutes per provider, 2 to 3 minutes per provider, and makes it very easy for you to meet those two crucial steps for EPCS from a DEA compliance perspective, while also creating that audit record. So from a logical access control, so starting with individual identity proofing, so again, as I mentioned, Confirm ID supports both institutional as well as individual identity proofing, and in fact, it will support a mix of both in your environment if you decide that some of your providers can be credentialed in-house and you'd like others to go through the individual process. So we partner with DigiCert, which is a federally approved certification authority, or CA, to enable easy individual identity proofing for EPCS. So DigiCert will conduct the identity proofing piece on the back end, and Imprivata will issue the authentication credentials that the providers will actually use to sign the EPCS orders. Now, if you elect to use individual identity proofing, the benefits of using Confirm ID and DigiCert is that all of the DigiCert components are managed through Imprivata. So there's no third-party vendor that you directly need to work with. All the DigiCert components are embedded into the Imprivata system. The ID proofing is done remotely, right from the Imprivata agent, from any endpoint on in your environment. Importantly, there's also a backup identity proofing option using a notary. So the primary method of individual identity proofing are those online questions, and it's going to be the fastest and easiest way for your providers to complete this process. However, if for any reason they can't complete that, maybe there's an issue with their credit report, they do have a backup option. They can print out information, bring it to a notary, have their ID checked there, and then upload this back to DigiCert. Now, again, that's a little time intensive both on the front end for the provider as well as on the back end. So it really is meant to be a backup option, but it's great to have for those individuals who, for whatever reason, cannot complete the online questions. And because DigiCert is a CA and not a credential service provider, that allows more flexible authentication options because it's Imprivata actually issuing the methods of authentication. So this will give you the flexibility to use fingerprint and our Imprivata ID token and any combination of those two of the three forms of authentication the provider needs to enter in whatever prescribing scenario that you have, which is going to make it a lot easier on your providers. So that's how Confirm ID can support the identity proofing for EPCS in whichever model you choose. From an access control perspective, within Confirm ID, we also have the role of EPCS access approver, and that's that second individual in the logical access control step that will actually approve the permissions that were given inside the EHR. So again, you create this role within the product, and you apply it to that approval workflow in your EHR, and these individuals will authenticate that, yes, in fact, the correct providers were given permission within the system for EPCS, and Confirm ID will create a record of that transaction for auditing and reporting purposes. And now, from the single tool, you have all the data you need and all the audit records you need on the identity proofing, the credential enrollment, and the logical access control step. And of course, Confirm ID is meant to not only help you meet all of the DEA requirements for EPCS, but make sure that two-factor authentication workflow is fast and easy for your providers. And we do this by providing the broadest range of DEA-compliant authentication methods. We support fingerprint biometrics, which is the something you are. We allow for a password, the something you know. And then we support all tokens, which is something you have. This includes traditional hardware tokens and software tokens, as well as some more innovative options like the push token notification and hands-free authentication, which is a workflow that's unique to Imprivata, and I'll talk about in just a moment. So offering all these different options is going to do a couple of things for you. First, it'll give your providers the flexibility to use the option that best meets their workflow requirements. You can mix and match. So for example, in a busy ED or a high volume discharge area, you may want the fastest possible option, which would be fingerprint plus hands-free authentication. No typing at all, hardly any interaction with technology to complete that two-factor authentication. However, in a remote or home prescribing scenario, maybe a password plus that push token notification is going to be sufficient. With Confirm ID, you'll have both, and the product will know exactly what is available to that provider at the time of prescribing, and they'll be presented with whatever the fastest option is. So in those two scenarios I provided, the provider will only be presented with what's fastest in each of those scenarios. They don't necessarily have to choose between the two options. The other thing that this will do is give you backup for redundancy. For example, if a provider doesn't have their phone running around in the hospital and they realize they don't have their phone, so therefore they don't have a token, fingerprint plus password is an option, and they'll still be able to complete that prescribing of controlled substances and that two-factor authentication workflow. This is particularly important to have a backup as more and more states mandate EPCS, and you're not allowed to have paper as that backup option. So quickly wanted to talk about two of the more innovative authentication options that we do have, starting with hands-free authentication. And again, this is unique to Imprivata, and this is really the fastest, most convenient way of completing that second factor of authentication. So it uses the Imprivata ID app, mobile app that's on the provider's phone. It's a traditional token app that generates a unique code every 30 seconds. However, instead of the provider having to manually type that over, it's all done wirelessly, and you could see the workflow here. So the provider will place the EPCS order in the application. Then they'll be asked for their first factor of authentication. In this case, it's a fingerprint, but it could be a password if you don't have fingerprint biometrics. Hands-free authentication will then automatically look for and retrieve that token code that's running on the provider's phone, and it will authenticate them wirelessly and send the EPCS order through. the provider doesn't have to unlock their phone, open up the token app, type over that 6-digit code. They don't even have to touch their phone. It can be locked and in their pocket, and it will complete this two-factor authentication. So you could see that particularly the combination of fingerprint plus hands-free really gives providers the fastest possible combination of two-factor authentication, and this can really be leveraged to drive efficiency in the EPCS workflow, again, particularly in high-volume areas. So I also mentioned the push token notification, and this also uses the Imprivata ID mobile app that's running on the provider's phone. It's very fast, very efficient, not quite hands-free, but in this case, all the provider has to do is approve a notification right from the lock screen of their phone to complete that second factor. So all they have to do is push that button, so they don't have to unlock the phone, they don't have to open up the app, and they don't have to type over that token code. So still much more fast and much more efficient than the traditional OTP software or hardware token. And the push token notification doesn't require any sort of hardware, so this can really be done from anywhere, which again is particularly important in a state that mandates EPCS, where the provider is not going to be able to fall back to paper. And that push token notification, that push token option, will be available for other workflows, such as two-factor authentication for remote network access through your VPN, accessing cloud applications, and a number of others. And so finally, from an EPCS perspective, Confirm ID is going to give you and your legal teams all the reporting functionality, all the audit records you need to comply with every step of the DEA process, especially when you combine it with the reporting that you'll get from your EHR system on the prescriptions themselves. So again, a complete picture to build that end-to-end auditable chain of trust that the DEA is looking for, and it's also going to allow you to configure your different audit records and audit retention based on state law. So the DEA requires that many of these records be kept for a minimum of 2 years, but in New York, the iStop law, for example, requires that some records be kept for 5 years. So the product can be configured depending on your individual state law. So the reporting and auditing functionality of Confirm ID really brings this all together, and again allows you from a single centralized location to show that you've met all of the requirements for DEA compliance for EPCS. Now let's just take a minute to look at a few customers who have successfully deployed Imprivata Confirm ID and how you can leverage the network that we have to be successful. So to date, we've got about 350 customers using Confirm ID for EPCS in nearly every state. Now, for those of you who may also be an Imprivata OneSign customer, Confirm ID uses all the same infrastructure, the same appliances, same endpoint agents, and the same administrative console, and a real familiar look and feel to your providers. So that's why many of our customers who use Confirm ID for EPCS also use Imprivata OneSign for enterprise single sign-on. And today we've got about 400,000 licensed users, and we're processing 11 million EPCS transactions. You could see here a list of some of the customers that we do have. So if you are interested in EPCS and you're looking for best practices from an implementation perspective or policies and procedures, we'll gladly put you in touch with any of our customers. Now, these customers are also measuring the success of EPCS. So we talked about some of the benefits: complying with state regulatory requirements, eliminating paper to really improve workflow efficiency, addressing the opioid epidemic by taking that paper prescription, the DEA number, out of the patient's hands. Well, customers have been able to measure the success of EPCS in a number of other ways as well. The Geisinger in Pennsylvania, for example, has calculated that they're saving about $1 million per month in things like provider time, LPN time, reduction in pharmacy callbacks, and a number other areas where EPCS has eliminated a lot of these inefficiencies, again, to the tune of nearly $1 million per month. Other customers measure the ROI of EPCS and Confirm ID with overall e-prescribing rates. Methodist Health System in Nebraska, for example, saw an increase of its overall e-prescribing by 85% by eliminating paper for controlled substances. What was happening in many cases is that providers, instead of performing a dual workflow, they would just put everything on paper, including the non-controlled substances, as a matter of efficiency. So by moving to EPCS, you transition everything to electronic, and as a result, a significant increase in overall e-prescribing rates. And then, as you might expect, there are some customers who measure overall a reduction in paper prescriptions and customers who saw a significant increase in their meaningful use e-prescribing rates, again, primarily because they can now count everything towards electronic prescribing because it's all electronic. It's not just non-controlled substances. So finally, before we open it up to questions, just wanted to touch on Imprivata Confirm ID as more of a complete multi-factor authentication solution. So because two-factor authentication is one of the requirements for EPCS, in many cases you may think, well, there are other workflows to which I'd like to add two-factor and second-factor authentication as a matter of improved security. Things like VPN access, cloud applications, maybe Windows servers or remote desktops for your IT administrators. And so when you're thinking about that in healthcare, there are particular considerations when you're evaluating an overall two-factor authentication solution. So first of all, is the authentication workflow efficient for users? Adding any layer of security in front of clinicians introduces the potential for inefficiency and a disruption of workflow. So it's important to implement an authentication solution that is still fast and seamless so that those providers can remain focused on their patients. Second, is the solution extensible to meet all of your multi-factor authentication requirements? So we've talked quite a bit about EPCS, but can that same solution be used to address your needs from a remote access and other workflow perspective? Because otherwise, you may be looking at a situation where you need multiple point solutions, and that's going to be difficult to manage and difficult to have your users manage two different tokens for two different workflows. And then, as we've been talking about, EPCS has some very specific and unique requirements from a compliance perspective. So it's really important that when you're evaluating solutions, you think, can this solution help me meet all of these requirements? Otherwise, again, you may be looking at a solution for security purposes, but if it can't meet all of these DEA requirements for EPCS, then you may find yourself needing to look for a second solution, which again introduces inefficiency and higher costs. And so Confirm ID as a platform is designed to be just that. It's designed to be a holistic enterprise multi-factor authentication platform that's really purpose-built to meet the unique requirements of healthcare. And this includes those innovative, unique authentication options that make security invisible for your providers in the EPCS workflow as well as any of the others. We also integrate with a broad ecosystem of healthcare applications and other systems to allow you to centralize all of your authentication needs from that single platform. And as we've been talking about, you can meet the specific compliance requirements of healthcare, particularly with EPCS, by using Confirm ID. And so ultimately the benefits of having this purpose-built, comprehensive, healthcare-specific authentication platform is really going to allow you to do things like provision accounts across your organization, streamline your reporting, lower your overall total cost of ownership, and really allow you to continue to add security without getting in the way of workflow. And as you can see here, Imprivata Confirm ID in and of itself is a platform that then integrates with the broader Imprivata Identity Authentication and Access Management platform that includes our OneSign as well as our identity governance piece to really help you build out this single purpose-built platform strategy for, again, helping you meet all of your authentication needs. So if you're starting with EPCS, this allows you to help you grow to a much more broader set of workflows and needs that you may have. So with that, we will now open it up to questions.
Thanks, Dan, for a great presentation. We certainly covered a lot of really useful information for us today. Okay, like Dan said, now is the time to get to your questions. We've received a few already. Just as a reminder, please enter your questions into the Q&A box on the right-hand side of your screen, and please be sure to use the question box and not the chat box. Okay, Dan, for our first question, this audience member asks, what is a good way to enroll several hundred providers?
So it's a good question, and typically what we hear from a rollout perspective is that the biggest variable is the actual enrollment of providers, and it will depend certainly on how many you have, but no matter how many you do have, because the DEA requires you to do that identity check in person, that can be the biggest obstacle that you'll need to overcome. So first I'll say that, Imprivata has done this hundreds of times in all different unique situations and scenarios. So I would encourage you to absolutely follow up directly with your Imprivata account team, and we can talk about your specific case and, what are some of the best practices in your particular scenario. But generally speaking, I would say that you can either hold enrollment fairs or you can go out to the providers and you can attend things like department meetings or grand rounds or other sort of naturally occurring meetings where multiple providers will be together, and you can sort of capture their information, trainings, for example, and you can enroll them at those times. Also, with Confirm ID, that role of enrollment supervisor that we talked about, the person actually checking the IDs, you can assign that to any number of people that you want. So if you do have providers that are spread out, for example, you could pick a few facilities and a few individuals in a few of the facilities to capture the providers there so that it's not one or two individuals from one central location going out to all these different folks. So there's a number of different creative ways and processes that we've seen customers have it in place. And again, I just encourage you to follow up with Imprivata, and we could talk about your specific situation and what we've seen work best.
Great, thanks, Dan. Our next question is, can the push notification only be used remotely?
No, the push notification can be used when you're on site as well. The product will always default to the most efficient form of authentication available at that time. So if you were using all of the methods of authentication, it would be fingerprint and hands-free authentication. But let's say you weren't using hands-free. It would then default to fingerprint plus the push token notification. It would know that hands-free is not available. And let's say you weren't using fingerprint either. It would default to password plus the push token because it would recognize there's not fingerprint available. But that push token can be used anywhere, anytime, within the hospital or clinic or remotely.
Thanks, Dan. Next question is, if a provider goes through identity proofing at another facility and then comes to our organization, do they need to do ID proofing again?
So the DEA really leaves that up to you, but from a best practice perspective, the answer is yes, you'll want to identity proof them again, because what the DEA is saying is that as an institutional practitioner, an organization with the DEA number, you have the right to give the permission for any provider to use your application to perform EPCS. Now, you'll want to ensure the identity of that provider before you give them that permission. So we highly recommend conducting identity proofing yourself for a new provider that's coming in, even if they've been identity proofed elsewhere, because in the event of an incident, the DEA is going to want to see where has that person's identity been checked to give them permissions and two-factor authentication to use your application. And if you're relying on identity proofing from another entity, then that may be a little bit risky from a compliance perspective.
Thanks, Dan. Looks like we have one more question, and this person's asking specifically in terms of Ohio, but perhaps you could answer more broadly. And they would like to know, is Confirm ID approved by the Ohio Board of Pharmacy?
This is a good question. Yeah, so for those of you in Ohio, you're familiar, of course, with the Ohio Board of Pharmacy regulations that require strong authentication for certain medication-related workflows, in addition, beyond EPCS. So even some inpatient medication workflows require strong authentication. And the answer is yes, absolutely. Imprivata is approved to meet those workflows. And there are a number of different workflows where you can apply a second factor of authentication. Again, Ohio state law requires that, but as an option, as a matter of policy, you could enforce second factor authentication or stronger authentication for certain workflows such as witnessing medication administration or destruction, inpatient admin ordering, et cetera. And Confirm ID can handle the authentication for those workflows as well. Now they aren't subject to all of the DEA requirements I've discussed specifically for EPCS, but if you wanted a faster, more auditable way of determining who is performing those workflows, you can apply Imprivata Confirm ID. And from the user's perspective, instead of needing to type a password to complete that re-authentication within the application, they can simply tap a badge or put a fingerprint down or use a token or use two-factor authentication depending on your policy. Again, it's not a two-factor requirement because it's not EPCS, but same principles apply, capturing that authentication, capturing the audit record in a way that's simple and easy for your providers.
Great, thanks, Dan. That takes us to the end of our Q&A session. If we weren't able to get to your question, we will follow up with you offline. I want to remind everyone that everyone that registered will receive a recording of the webinar, so keep an eye out for that in the next couple of days. And with that said, I want to thank everyone again for joining us for today's presentation. This concludes our webinar. Take care.